To start, for a little bit of background, what is the Heirs Foundation and how did it get started?
So the Heirs Foundation is an acronym for the Alliance in Reconstructive Surgery. And my business partner and longtime friends, we've been friends for 46 years. I say this, everybody has ups and downs in their lives, but at the end of the day, we were blessed and we wanted to do something to give back. So I wrote to a friend of mine, and we wanted to give a voice to something that had no voice, which is hard to do because there's so many foundations out there dealing with so many different issues. But finding one, which we wanted to do. So I wrote to a doctor that I'm friends with, Dr. Rod Rourke, who's a plastic surgeon here in Dallas, and he wrote back to me and said that up to 70% of women who have mastectomies due to breast cancer either don't know about their options, they don't have money to meet their copays, or they have no insurance. And we were sort of surprised to hear this because most of the people we know have really good insurance, and no one ever talked about this being an issue. But all of a sudden, when you start to talk to the underserved population, of which it's big in this country, they don't really know about their reconstruction options. The doctors, the breast surgeons don't necessarily tell them about it. And even if they have insurance, these people we're helping are making $30,000 a year and they have a family of 2 or 4. So meeting a $5,000 copay is virtually impossible for them. So we really try to educate women about their reconstruction options. And if they can't meet their copays or have no insurance, we work with them to enable them to get reconstructive surgery. It's very important for women because some women prefer to go flat. And if you want to go flat, that's great, go flat. But on the other hand, we live in a breast society. And, you see everybody walking on the red carpet with very low cut dresses. And this is the message we send to everybody. So it's really about helping a woman restore her self-esteem and helping her to feel better about herself. And that's really what we do, is we help women to move on and feel better.
So would you say that is the overall general mission of the organization, or is it more in depth than that?
Well, it's really to educate women about their reconstruction options and to help them meet their copays or pay for their surgery. I mean, that's really what we're doing here, is educating women and allowing them to know that there's hope from them someplace who will help them, someone will help them.
And kind of looking at what the organization does as a whole, how has kind of these times with, the COVID-19 pandemic been affecting the mission? Has it affected it at all? And if so, how have you been shifting to keep the mission during these times?
Well, we're still accepting applications and we're still encouraging people to apply to us. And we're funding surgeries. I mean, last week we funded 4 surgeries. Now, a lot of them are being put on hold, and that's okay because we have the advocates still talking to them, making sure they're okay and doing okay while they're waiting. So we're encouraging people to continue to apply for us, even though their surgeries might not be now, they might be delayed. They might as well be in the queue because eventually this will end and their surgeries will take place. What we're also hearing, and we're addressing this, is the concern of, if I put off having my reconstructive surgery, what does that mean? If I put off having my mastectomy, what does that mean? Because in these times, a lot of those things are really being delayed. So we're doing a few things to really try to educate the public. One is we're continuing our focus on social media to allow people to know that we're here and, so actively helping people. Last week, we did our first on live Facebook event. And we had Dr. Jonathan Bank, who does reconstructive surgery out of New York, and Melissa Berry, who has a site called the Cancer Fashionista. And they answered a lot of people's questions about, where do I stand with my reconstructive surgery? What happens if my expanders get left in? We were really sort of trying to answer all the questions that come up.